Everybody. I would like to welcome you to tonight's meeting with the councillors are required to attend in person. We'll be using the equipment connecting the chambers into the Microsoft Teams meeting, and some of the officers involved this evening will be joining remotely via Teams. I need to inform everyone present that this meeting will be recorded and broadcast live on the internet through the Teams, and a recording of the meeting will then be uploaded and available to repeat view on the council's website. Welcome to those online, welcome everybody, and Happy New Year to everybody. We start our business today with apologies for absence. Councillor Finn Councillor Finn McGoldrick has put in an apology. She's not able to attend today. And then Councillor Isabel Bell is not feeling well. She's not able to attend today also. We move to our first item on the agenda, which is declaration of interest. Anyone in the chamber or online with declaration of interest? Yes, Councillor Davis.
I have an interest in item 11 because someone in my household uses home to school transport. So I'll leave the room at that point.
Okay, thank you. Anybody else?
I have an interest in the school transport item as I work in a school, but I don't think I'm prejudiced, so I don't think I'll need to leave the room.
Okay, all right. Okay, thank you, noted. So we go to item number 2, which is the minutes of the Adult Social Care, Children's Service and Education Committee, which was the last one we had on the 18th of October 2023. Is there anything anybody wanted to raise if you have read through the minutes? Anybody? Okay, and then we go to item number 3, if there's nothing, minutes of other bodies, the Health and Wellbeing Board minutes which are there, which was for the 6th of October 2023. Is there anything, matters arising, anybody wanted to raise on this one? No, thank you. On item 4, petitions, there is none today for our meeting, so we move swiftly to item number 5. Again, questions from members of the public and councillors. There are none today. Thank you. And then we move to our big item agenda from the Berkshire Healthcare, which is item 6, the Berkshire Healthcare NHS Foundation Trust. Their own teams, Kishani Wazi, Service Director of the Mental Health Community Service, Louis Noble, Service Director to LD and CAMS, Karen Creedled, Division Director. Welcome to our meeting, to our S committee meeting today. Thank you very much.
Thank you. Would you like us to introduce ourselves and then do our presentations?
Yes, please. Thank you.
Okay. I'm Karen Cridland and I'm the Divisional Director of Children, Family and All Age Services. I'll pass over to Louise.
Good evening. I'm Louise Noble. I'm the Service Director for Children and Young People's Mental Health Services, the All Age Eating Disorders Service and Learning Disability Services in Berkshire Healthcare.
And Kishan.
Good evening, everyone. I'm Kishan Was, Service Director for Community Mental Health Services across Berkshire.
We were asked to come today to present our services around mental health for children and working age adults, including neurodiversity, on our weights and trends. So thank you for your interest in this topic. These are 3 large topic areas, which is why you've got 3 presenters here, and the paper and the presentation was split into 3 parts. So I'm going to share our presentation and Keishan's going to kick off first to talk about the working age mental health. Then Louise will talk about children's mental health services, and I will finish talking about neurodiversity services. So I'll just share our presentation.
Thank you, Karen.
Is it showing?
It is showing, yeah. If you could go to the next slide.
Yeah, I'm just going to do it from, I'm trying to do it from, oh, I can't do it from slideshow, Kishan. I'm afraid it'll have to go like this. Is that okay?
That's okay, yeah. So the plan I have is to give you a overview of all the mental health services we have for working age adults. I've taken this diagram from NHS England, which basically gives you a view of what services look like into categories. So from low level need to common mental health needs, kind of then severe mental illness, and then also kind of your urgent care crisis type presentations. And on the what I've done is I've kind of grouped the slides, the services in the same colors, so to kind of give some idea of where they sit and what it looks like. Aaron, can I go to the next slide, please? So kind of main areas of development that's happened recently. On the yellow line, you have something called Rs, which is essentially mental health practitioners working within GP practices now, providing mental health assessment and follow-ups. So that's kind of a new development. And what they do is they kind of cover that frontline assessment and then pass on people into other mental health services if they need to go to. The second one is mixed services. Again, this is a new service, and the service is designed to bridge the gap between primary care and secondary care. This service picks up referrals from GP practices, but the service also works as a conduit into kind of secondary care and then from secondary care back to primary care as well. So there's an ability to patients to move across in that conduit and there's a patient pathway. SUN is a service user network designed for EUPD and is service user led. And again, these are all kind of new service provisions that have come across as part of the transformation. And then we've got Let's Connect, which is a social network that's available to Reading residents to come together to support each other, and is facilitated by some staff. And they also provide some advice around assets that are available to meet their needs in the community. We included liaison and diversion and reconnect services here. These services are primarily operate within the criminal justice side. Liaison and diversion has practitioners working within police stations, courts, Crown Court, and also in the community, assessing individuals who may have a health vulnerability whilst they navigate the criminal justice pathway. And reconnect service is the other side of the spectrum for people who are in prison, coming out, who have health needs already met in prison. So when they come out, those needs being bridged into the community. And then we have the Carers Hub to support carers, and I've included IPS. And IPS you will see across all those colours there. And it's primarily a service designed to support people into employment, people with mental illness, but also those who are in employment to support them in retaining it. And then we move on to common mental health conditions. IAP services, you would have heard about this. It's called kind of talking therapies. They provide structured CBT therapies. And then on the green column, you've got your traditional CMHT service, provides secondary mental health services. EIP, which stands for Early Intervention in Psychosis, it's a service designed to support people in their first episode of psychosis. IPT is our psychological service. Again, design services kind of primarily focus on people in CMHT. And then we've got a trauma service. Impact and Assist are services who provide interventions for personality disorder clients. Ops Courage is a service designed to providing support for veterans. And I kind of mentioned IPS and Let's Connect already. And then the dark blue color is kind of your kind of urgent crisis type interventions. We have psychological medicine service that's based at RBH. assessing and signposting and offering input for people who may have harmed themselves or in type of crisis presentation. CRFTT is our home treatment team, provides kind of alternate to admission type interventions, and then our inpatients. As you can see, it's quite a range of services for the layperson. It's quite difficult to identify which services might be appropriate. So we have the gateway team, which accepts all referrals, and they do the frontline assessment and then directs the patient to the right service. Can we have the next slide, please? So this, just to give a brief overview of where our weights are currently. So IAP services, you can see, a high number of referrals month on month. They generally see somebody for assessment within about 8 days, and about 92% of clients from Reading get treatment within about 7 weeks of their referral. And then you've got the mixed team. Again, this is a new service run just over a year now. You can see the referrals are increasing. However, they also got high caseloads now. They're coming up to like 257 cases, and they have an average wait of about 2 weeks. And that's kind of the target that they got. And then to CMHT, again, you could see that the referrals kind of vary from 30 to 50. And open caseload is about 750 to 780. But they got waiting time for care coordination about 4 weeks, and for psychiatric assessments from a consultant is about just over 9 weeks. Next slide. Thank you, Karen. So IPT is kind of for structured psychological interventions. Currently have 15 residents who are waiting for group therapy, 5 individuals who are waiting for individual therapy. So it takes a total of 20, and 10 individuals waiting for assessments. And the longest wait for kind of is from February 23. So just around 11 months is kind of what we have there. Then we have EIP. EIP, as I said, is for early intervention psychosis. And Reading has the highest caseload across Berkshire, and they've got a waiting time of 1 to 2 weeks, and which is within their waiting time frame. So that's kind of a whistle-stop tour about where we are. I mean, I have included the challenges we have and also some of the one team stuff, but probably might not have time to go through it today. So I don't know if I want to hand over to Louise. Happy to go by Karen. What do you think?
Sorry, my computer's reacting very slowly. If you want to just do a quick bit about the challenges, sure. Yeah. Yeah, so the main challenges are kind of universal. You can probably already heard about these. So we've got increase in demand and capacity. Most of our health services have had like 40% increase in demand. And then we also have workforce challenges, which is a national issue, but more so affected in Berkshire for us. And that's kind of links to kind of staff burnout, because we've got less staff to do the work and expectations high. And this is compounded by some of those kind of complex presentations. But we also have identified that we also have differing thresholds in the region. So different localities have different thresholds, and also variation in offer. So to address some of these, what we've done is we've started a transformation team under the heading of One Team, which is essentially to address some of those disparities that we have and address them as a whole. And we're kind of developing things like how we can adapt our processes to make it a bit more slicker. So kind of looking at trusted assessment arrangements, and also having kind of a place-based MDT so that we can address individuals' needs more holistically. So essentially, there's kind of a whole list of things that we're doing. We're trying to kind of also kind of address those barriers that we have between primary care and secondary care. So some of our mixed services and ours workers were part of that One Team delivery from last year. Thank you, Karen. Okay, I'll hand over to Louise Noble now, who will talk to you about children's mental health services.
Thanks, Karen. If you could give me my first slide, that'd be really helpful. Thank you.
Is it not up, Louise?
No, that's just the header slide. So if you could take me, take me to the next one. Thank you.
Right.
That's it. Perfect. Thank you.
Okay.
So as Kishan has described, for adult mental health services, Berkshire Healthcare provide quite a wide range of services for children and young people with mental health needs. Under what we would have previously described as the tier model for services, most of the services that we provide in the Reading locality would have been described as sitting within tier 3 and tier 4, but we now work to a model called the Thrive Framework for System Change that some of you may be very aware of, and we've included information about in the paper. And what this slide does is it describes the way our services are structured according to that Thrive framework. CAMHS and children's services generally are already aligned on a Berkshire-wide footprint, and a lot of the challenges that adult services are seeking to address in the One team are challenges that we've already done quite a lot of work on within the CYP world. However, we've still got things to build on, and so we will be taking some of the learning from the One team and some of the work that they're putting and implementing that in CYP as well. So our services, we have what we call the CAMHS Common Point of Entry, which is very similar to the Adult Gateway service. So that used to be the single point of access to CAMHS services, but as children and young people's mental health has become much more well invested and kind of aware, there's been a lot more awareness of children and young people's mental health. We have a whole host of new services that have been being developed, and that has increased the range of access points for children and young people. So that common point of entry still functions as a gateway, but we do have other points into the service. We have a whole range of specialist services at what we describe under the Thrive framework as getting more help level. So our locality specialist community teams, very similar to the adult community mental health teams, provide interventions for children and young people presenting with complex mental health difficulties. So we have a specific CYP early intervention in psychosis team. We have a children and young people's eating disorders service that we run as actually part of an all-age service. So rather than having a separate service for adults and young people, that is an integrated service which enables us to support transition to different treatment models more effectively. And those locality specialist community teams will work with children and young people presenting with very complex difficulties, often very emotionally dysregulated, young people who may go on in adulthood to be given a diagnosis of borderline personality disorder, who may be traumatized, who may be experiencing mania and complex depression and things like that. We have what used to be a CAMHS Tier 4 inpatient unit. We no longer run that as an inpatient unit in Berkshire. About 3 years or so ago, NHS England supported us to develop an alternative model as part of their new care models programme. And so we now have a unit that runs 7 days a week, but runs as an alternative daycare, an extended daycare and home treatment model, and that's been very, very, very successful in reducing the need for young people to be admitted to inpatient units, particularly those young people whose needs are not well met in those types of units, and where we don't have units locally, and so it's enabled us to keep young people much closer to home and to support them within their family networks. We have risk support services. We have a crisis assessment team that similarly to the adult psychological medicine service is based at the Royal Berks Hospital, but also supports young people presenting in crisis through NHS 111 or crisis calls that come in through to our common point of entry. And alongside that team, we have an intensive treatment team that provides short-term, very, very intensive focused support to young people to de-escalate from crisis and support them into more appropriate support. About 75% of young people presenting to our crisis services aren't known to CAMHS. It's their first presentation. A very high percentage of those are presenting due to challenges in terms of their relationships or school. Those are the two kind of main triggers for crisis, and again a very high percentage of them don't go on to need intensive mental health support. They need support at different levels to manage the triggers for their kind of emotional difficulties at that point. We don't provide very many of the getting help level services within Reading. Those services are what we would tend to describe as primary mental health services and mental health support teams, and in Reading those services are provided by Brighter Futures for Children. However, we work very, very closely with our colleagues and we have specialist CAMHS expertise that works alongside and is part of triage and supporting the MHSTs. We do have an anxiety disorder treatment team, and from this year we have been commissioning the anxiety and depression research team that is based at the University of Reading. And some of our transformation work is about working more collaboratively with Brighter Futures for Children and how we can kind of streamline the support for children and young people at that level and improve things. If I could have the next slide, Karen, please. I've given more detail on waiting times, numbers waiting and waiting times for our services in the paper. CAMHS nationally has been seeing a growth in referrals year on year up to the point of the pandemic. And broadly speaking, we've seen that trend continue. We've seen a slightly lower increase in Reading. So since the pandemic, the referrals have gone up by about 7%, specifically to our mental health services. That's a little bit lower than West Berkshire, which is the other locality in Reading where we provide a similar portfolio of services. We think that that's a really positive indicator of the really good work that's been going on in terms of schools, in terms of the trauma-informed approach that Reading have adopted, and the really great work being done by the primary mental health services. And we're really keen to build further on that collaboration. CAMHS waiting times have historically been long and challenging, and Berkshire is not different, and the Reading locality is not different to the national picture in relation to that. Prior to the pandemic, NHS England were starting to run some pilot projects to kind of really understand what a national access and waiting time target might look like for children and young people's services, and their aspiration really was to be able to set a 4-week waiting target. Where they've got to is that this year they have introduced for the first time a standardised definition of waiting for children and young people's mental health services, which is really beneficial because at the moment we've got no consistency in terms of what is meant by waiting. So we have started to implement that, and they've started to implement some new metrics to enable us to see where we are in terms of meeting any of those standards. So the graph that you've got in front of them is one of the new metrics that they are tracking, and that shows children and young people's referrals who have one contact recorded, the percentage of those that have that contact recorded within 4 weeks of the initial referral. It's a bit of a complicated graph and difficult to see the various different colours. What I've given you there is the England data, South East region, the Bob Integrated Care System, Berkshire Healthcare generally, and then Reading specifically. We've been tracking slightly lower than the South East and England region, but since August we've been on an improvement trajectory and are now performing better than the Bob ICB and the South East region and approaching the kind of England levels, which is really, really positive to see. Those waiting times hide quite a lot of variation. So, for example, our EIP service has national access and waiting time standards, which are 2 weeks, and we meet those standards. So we don't have any young people waiting longer than 2 weeks to start treatment in that team. And our eating disorders service, there are national targets for urgent referrals to start treatment within a week and routine referrals to start treatment within 4 weeks. We meet those targets. And our crisis service see young people within hours. So there is quite considerable variation in waits. You could give me the next slide, Karen, please. We have a huge amount of transformation and development going on within CAMHS, and as you won't be surprised to see, waiting times is kind of quite a significant focus. So we have within the trust what we call QMIS, which is our quality management improvement system, which we've been really focused on implementing. intensively across CAMS over the last year. We have a quality improvement lead who's been doing some really great work on that. A number of our teams have weekly improvement huddles where we bring improvement ideas from staff, but also from young people, and structured feedback, including things like compliments, complaints, and any learning from incidents we also bring into those improvement huddles, so that we're really, really proactively acting on them. We have a number of dedicated quality improvement projects going on in the service. Kishan highlighted the challenges around recruitment and workforce and burnout and retention. So we've had a really, really successful quality improvement project in our crisis team, where we had a very, very high turnover and a very high proportion of agency staff, which was focused on improving staff joy in work and therefore retaining. And we are now fully recruited and have a really stable workforce, and have successfully recruited about 30 staff over the period of that project. The graphs also indicates that some of the work that we've been doing to reduce referral waiting times. So our CAMS common point of entry shows you that at one point the kind of average week from referral to first appointment for a routine referral in that team was up to 25 weeks, but has now been kind of tracking closer to 5 weeks, which is great. And our Reading specialist community team have been really focused on improving clinical activity levels and making sure that staff are released to do spend as much of their time as possible on working directly face to face with children and young people. And that's had a really significant impact on reducing referral waiting times, which is really good to see. If I could have my final slide, Karen. Thank you. We have also very positively had a number of new developments in the CAMS service, so some services that started last year and some services that are going live this year. We have a new CAMS Children in Care service working across the west of Berkshire, which has dedicated workforce working closely with children's social care. In the Children in Care team in Reading. That service went live last year, is fully recruited, and we have really positive feedback from colleagues within social care as to the impact and effectiveness of that service. Our crisis service we were able to extend to operate 7 days a week, and then we ran a successful pilot in the Royal Berks in the first quarter of this year. To extend that service to 24/7, which has been substantively funded and is proving to be really beneficial in being able to discharge young people from A&E very, very swiftly and provide very quick follow-up to them in the community. We have a new CAMS LD service, which has been a long-standing and quite significant gap for us. That has been commissioned and goes live this month, which is very exciting. And then we have something called the Berkshire Link team, which is the Berkshire spoke of a Thames Valley-wide project, which is focused on implementing the framework for integrated care for children and young people with needs that are described as complex. The Children in Care service, the Link team, along with our crisis service and the Thames Valley Forensic Service, will be working collaboratively together, and they work very much to a trauma-informed model using mentalisation approaches and working with the trusted adults who work very closely with children and young people, rather than bringing in new and unknown clinical staff to provide to form new relationships. We also have the ARRS roles that Kishan talked about in primary care. We are piloting a children and young people's mental health role in primary care at the University Medical Centre Primary Care Network, and that role started in November last year, and we're already seeing real benefits from that. Actually, we're already able to signpost and direct young people to the right service, and we're getting some really good feedback in terms of the reduction in their journey. And then alongside that, we run something called the DSR, the Dynamic Support Register, and the Key Working Service, which is not a CAMS service, but it is a specific dedicated service to support children and young people and their families who have a learning disability and or autism and are at risk of admission to hospital. So lots of really, really positive and exciting developments within children and young people's mental health. Thank you. I'll hand you back to Karen.
Okay, thank you, Louise and Kishan. So I'm going to talk about our autism and ADHD service. The information in your paper is written by our head of service, Mary Jane Stroud, but I'm here to present on her behalf. And before I present anything, I just want to describe our service. So our service does not sit within our mental health services, but we recognise that children, young people and adults who are diagnosed with autism and ADHD may have some comorbid mental health issues. What I'd also like to describe in our service is that our service is a diagnostic service only in autism. And that's important when we can move forward to think about actually how do we support children, young people and adults with autism. Our ADHD service is both a diagnostic and a treatment service in the fact that children and adults may be prescribed medication where appropriate to support them. So the reason for talking about that is actually what's really important for anybody with a diagnosis called neurodiversity, so autism, ADHD, is actually there's a strong emphasis on the support around them, which is provided in partnership by some of the services provided by Berkshire Healthcare, but also many of the services provided by Brighter Futures and by schools and by our third sector. So the reason for giving that is that the support that a person requires is present both before and after diagnosis, and is present even if the person does not get a diagnosis of ADHD or autism. And in Berkshire, we're very fortunate to have a wide range of support for families. And as I said, most of them are available at any point. And when we referred a person into our service, certainly for children's services, we provide the information on all the sources of support for families to ensure that families can access the support as soon as possible and aren't waiting for the diagnostic process to start. And the referral pack also contains a letter for school to emphasise the needs-led support, and that we can support that being in place before the diagnosis. So in terms of our contexts and challenges, they're not dissimilar to the contexts and challenges that Louise and Kishan have discussed. There continues to be a high and growing demand for autism and ADHD diagnostic services, and this has happened year on year. This is not a Berkshire only picture, this is a national picture in the services. We've also had additional pressures from COVID-19 and also, as both Louise and Kishan have described, a national shortage of qualified staff. And more recently, the pressures on the service and therefore on the children and their families is there's been a national shortage of ADHD medication, which has impacted obviously on the children and their families, but also on the service and our ability to support the people in our care. I talked about autism and ADHD being a diagnostic service. The difference with ADHD is that actually we go on to support the children or adults that refer to us in terms of the fact that they may be prescribed medication. This means with ADHD, the people in our service stay on our stay in our care. And it's what we therefore describe as a balloon service, because referrals outweigh the number of people we can discharge, and therefore the team caseload continues to grow. Autism is different in the fact that once we've made a diagnosis, we pass the children off our caseload into the services that can support them. The other thing that's happening with the people being referred to us is they're coming through with far more complex presentations, and that's both for adults and children and young people. But what we want to highlight is reducing the waiting time remains a top priority for us. So what's our current picture? So I don't have the data for the adult service on a Reading basis, but we do for the children. So bear with me for the adult service. So our adult services, we've got 1,200 waiting for an autism assessment and 2,083 waiting for ADHD. That's across Berkshire. So that's about 60% in the west of the county and 40% in the east. In the adult service, the average time for waiting is 81 weeks for autism, 68 for ADHD. And the percentage of people, adults waiting for more than 2 years for an assessment is 29% for autism and 15% for ADHD. The children's service, so Berkshire Y, well, I'll give you the Reading figures. And number waiting for an autism assessment in Reading is 902, and it's in ADHD it's 683. In Reading, our ADHD referrals tend to be higher than they are for the other 5 local authority areas in Berkshire. The average wait for those waiting for in Reading is 59 weeks for autism and 56 weeks for ADHD. That's the average wait. We do prioritise some of the children and young people depending on their needs, which means some people are waiting longer than the average wait, and obviously some people are seen much quicker. So what we're actually looking for is the percentage of people waiting more than 2 years, which for autism, those waiting for more than 2 years, the percentage is 2%, and ADHD, it's 8% waiting more than 2 years. So that's our current picture. I'm going to talk about some of the work that we have done. Sorry, I apologise, my computer's reacting quite slowly. So in the children's arena, you know, we recognise 2 years is still a very long wait. We have reduced it down for no one waiting for longer than 3.5 years, but we do recognise 2 years is a long wait for children and their families and also our adult clients. So as I said earlier, what is very key is actually the support and the that is provided to meet the needs of the children, young people and adults. And this is available, and we have quite a lot of support available in Berkshire. So the NHS commissions support for autism and ADHD across the west of Berkshire. And there's a commission from Autism Berkshire, and they provide a range of advice, workshops and courses, which is, as I said, available to families at any point. We also provide what's called PEP care training, and this is to empower settings such as schools to understand and meet the needs of children and young people who are neurodiverse. And then Berkshire Healthcare provides newsletters to update families and other stakeholders. Within Berkshire, we've worked really closely with our colleagues, not only in Brighter Futures, but also our health colleagues across the BOB system, and to share learning and innovation and respond to challenges that are faced by all services, and also to learn from each other. So this includes the role of artificial intelligence in terms of supporting assessments and increasing our capacity. And we're also looking across BOB a pilot of what's called Spencer 3D in schools. And this is a digital tool that can actually profile and support the identified needs of the child or the young person in school settings, so we can actually meet their needs quicker and in a more identified way. The other thing that we've been doing in Berkshire Healthcare is looking at how we increase our capacity. So we've got partnership working with external providers. So we work with the independent sector to support our to increase our capacity for assessments. Although we've, like Keishan and Louise, have had been affected by national shortage of professionals, we too have also been really successful in recruitment to new posts and are actually also almost fully staffed as well. But we've also been offering weekend clinics and to increase our appointments, but this has been offset by our increase in referrals as well. And a bit like Louise has described, the service has looked at a number of quality improvement and continuous improvement events to create efficiencies and release capacities, and also to improve the family experience. And we're having a particular focus on digital solutions, including automation of some of our tasks. And we've looked at improving our referral processes, looking at how we reduce DNAs, that's do not attend, so where children, young people, adults don't attend their appointments, how we can make the assessment process shorter, and I've talked about automating some tasks. I talked about prioritisation of referrals, so those children and young people in need are seen quicker, so that will include children in care, children on child protection plan, and those involved in the criminal justice system. And also those that are currently unable to access education or where educational placement requires formal diagnosis, or those young people presenting at risk. And then just very quickly, because I know we've taken up a lot of your time, the adult focus, we've been looking at a referral and triage process to improve that, and also signposting people to appropriate support services. We've been looking at reducing our annual wait for the ADHD medication review, generally looking at our processes and looking at our support options. Okay, I think I'll wrap it up there, and obviously we're ready for any questions that you might wish to ask us.
Thank you so much for a detailed report, and we are now firing it back to the chamber here. And any questions, please? We'll start, Councillor Cresswell, and then we'll come to you, Councillor Davis. We can't hear you.
Let's switch it on. There we go. Is that working?
Hello, am I coming through? Yes, good stuff. Thanks for the report, very interesting, and it's good to see the wide variety of services being offered. I've got a question about the figures for waiting time for the autism and ADHD assessments. The question is, where we have the figure for the average wait in weeks for those waiting, I read that as being the average wait for people still in the queue. Is that correct? If it is,
yes, sorry, it is. So it's a bit confusing. Those who the average wait for those waiting are those that haven't been seen yet. Yeah. The average wait for those who have attended appointments is once we've seen them in December. So we've given figures for December 23. We can work back and do the average wait for those waited. So they're slightly different figures.
Yeah, okay. So you'd expect the average wait for those in a queue to be half the queue length, generally, if everything stays the same. So it looks like the queues are getting a little bit longer. But if we want to know how long people are generally waiting, we should be looking at the row, the average wait in weeks for those who for December, which is it's about a 2-year wait, then I guess. Yeah. And the row where it says the percentage waiting more than 2 years, is that the percentage of people in the queue who have already been waiting 2 years? If it is that would tally with the other figures, but all that tells you is that only 2 or 8% of the queue have already been waiting for 2 years, but we would expect everyone in the queue to have a 2-year wait. So it needs to be quite clearly described, I think, because... Okay,
so we are working towards no one waiting for longer than 2 years. So the 2% for Reading, well, actually it's the same as at Berkshire wide, means those people that we've seen, nobody's waited more than 2 years. So the metric we're working towards is to get our waiting list down to less than 2 years. So that's our measure.
Thanks. I'd invite you to check that measure is how you're interpreting it, because for the December ADHD assessments, the average wait was more than 2 years. So that's not really consistent with the 8%. I think it would be more consistent if it was the proportion in the queue who'd been more than 2 years.
Okay, I'll need to come back to you on that one.
Thanks.
Okay, we go to Councillor Davis.
Thank you. Firstly, thank you for the report. It's clear that there's a huge range of mental health services across Berkshire, which made the report for people who aren't really well versed in NHS services quite a difficult read. There's lots and lots of information there, tons of acronyms and jargon, etc., etc. And I understand that a complex service requires, you know, a lot of information in different ways. So I appreciate that. Didn't expect it to be Ladybird book. So thank you, and thanks for that. And following on from what Councillor Creswell said, what leaps out is that table on page 20, particularly about neurodiversity services. And without getting into the statistical and techie stuff that gratefully Councillor Creswell, I'm grateful for, tried to clear up, it does seem, whichever way you cut it, it's a huge amount of time for a child to be waiting for an autism diagnosis, 154 weeks, and that's 3 years, and during that time, that is going to be a fair proportion of the life of a child or young person who may suspect they have autism but hasn't got a diagnosis, and a diagnosis opens doors, as you will know, in education and other services. So you know, you rightly talked about focusing on reducing that, but I just wondered if you might be able to expand on what the impact is for the patients, for the children and service users who are waiting for that time. What like there's a huge long length of time to wait, and you know, is their condition deteriorating? Are they developing other mental health sort of conditions as a result of that period? What is the risk to them of having to wait up to 3 years?
So if we look at the SEND agenda, it's around meeting a child's needs rather than being based on diagnosis. So as a system, we need to really work together to look at the child's needs irrespective of diagnosis. So I think that's some work that we're doing across across Berkshire, but also with Brighter Futures. So that in terms of autism, a child's needs doesn't change whether so the child's needs are there the day before their diagnosis and the day after their diagnosis. So in terms of their needs, we will be working and supporting across the system that child's needs anyway. So whether it will be around sensory concerns and they need support from their schools or from an occupational therapist, whether they have social emotional well-being concerns. Louise has described the Getting Help services that are again provided by Brighter Futures and also by the CAMS service going through. I think you know, 2 years is too long to wait. I don't think any of us would deny that. But going now and going forward, it is about meeting the child's needs irrespective of diagnosis.
Thank you.
Councillor Gittings.
Yeah, thanks. I mean, I obviously echoed some of the comments of my my colleague Councillor Davis here, obviously in terms of the length of waits, and as I say, whether the technicality, whether it's 56 weeks or 3 years, these are astonishingly long waits. And when this came to Health and Wellbeing Board, there was a group of parents, I think, you know, who supporting young people and do fantastic work. But I think the feedback from them, there was the waits were unacceptable. And look, I'm not blaming you because you're trying to sort this. So I suppose my question would be, I mean, look, trauma-informed approaches in schools is obviously incredibly important because the schools obviously recognise, they're not stupid, they recognise that some people without needing to have a diagnosis are clearly showing some signs that the children are struggling because of neurodiversity issues. So that all that's fine. But I suppose my question would be, what's the one, and it's a slightly unfair question, what's the one sort of magic bullet we would have to cut these delays, both in adult children's services, but also adult services? I'm lead counsellor adult social care, and I know that there's a big pressure on local authorities and our services as well, because of the increasing number of people who are either undiagnosed or are struggling to get the support they need. So I suppose what will be the magic bullet? What can we do to fix this? Because this is a national problem, but it just seems to be insurmountable, and these lists are getting longer.
That is a very difficult question.
Sorry, it's a big no. I just wanted the single thing. I mean, Labour is talking, and look, I'm a politician, we're talking about an increasing number of staff, thousands, I suppose, which is fine. Also having mental health advisors in schools, which I also think is long overdue. But I suppose my other question is, are those people available, and would that staff make the big difference?
I think I can't give you a single quick answer. What I can do is describe what's happened. We in Berkshire West, we had quite a lot of investment from the former CCG, Berkshire West Clinical Commissioning Group, into our children's neurodiversity services to the tune of 1.6 million each year. It brought our waiting times down from the longest wait from 3.5 years to 2 years. And that was a huge amount of investment. And we could look at keep on investing more, but then I think, as you quite rightly said, are the people out there? We have had a very successful recruitment campaign, but we had also been short-staffed for some time because there was a national shortage of people. I think, and I know I've laboured this point quite a bit, my concern is about meeting a child's needs or an adult's needs, irrespective of diagnosis. So there is something about us working together, both from the health service and the education services and our social care colleagues, as well as the third sector, about actually looking at making all our services and all our provision neurodiverse friendly, so the people in our services needs are met irrespective of diagnosis. We may then find that people don't need to seek diagnosis because their needs are being met. There will always be people that will need assessment. You know, we're not talking about not doing the assessment, but actually the key for me is about actually meeting people's needs. Louise, I don't know if you wanted to add anything.
Yeah, no, I just would agree with that. So we know that young people and adults who are given a neurodivergence diagnosis are at greater risk of mental health difficulties, but actually quite a lot of those people, when they present to our services, it's not that they need a traditional mental health treatment. They don't need a talking therapy. They're not going to respond necessarily to medication. Actually, what we're often looking at is how we can work with the school or with their workplace or the environment to address some of the environmental factors or the challenges in terms of kind of communication that may be creating them stress and trauma kind of on a daily basis, really. So certainly from a mental health perspective, actually providing support that is based on the needs that a young person or an adult are presenting with, be that looking at colours, looking at lighting, looking at how we can support them in terms of understanding their thinking style, social communication, is what's going to make a big difference. And we should be doing that regardless of whether they have a diagnosis or not. In most instances, as Karen says, there will always be people that, you know, for whom a diagnosis makes a huge difference to their understanding of themselves and their ability to seek the right support and help, and that's really important. But the more we as communities and you know, people working with young people and adults to support them can better understand the needs of people who are neurodivergent, I think the less challenge we're going to see in terms of their deteriorating health difficulties.
Thank you. Councillor Girvin.
Thank you, Chair. First, a plea before I say what I wanted to say. Could we have a dictionary of the acronyms, please? Because, to be honest, I can see you smiling, but actually, as a counsellor reading these papers at home, they were a complete gobbledygook to me, because the acronyms were a barrier. I didn't understand what was being said. And it isn't until you've talked through the presentation this evening that I've got a better understanding. So could we please have, together with the presentation, which I think has been distributed, could we please have a dictionary of an acronym so that we actually understand what you're referring to, because it is a barrier if you're not an expert.
Yes, and I was smiling, not because I realised when you said it that we hadn't provided the acronyms or written them in a way that made sense. So I apologise for that.
Thank you. So I just want to take up, and I know we've talked a lot in a very detailed report, which has some good news and some not such good news. We've talked a lot about these waiting lists, but I am disturbed that your aim is to reduce it to 2 years. 2 years for a 6-year-old, 2 years for a 9-year-old, 2 years for a 13-year-old is way too long. They're never going to get back those years in which their needs may be met better. I completely agree and I come from an education background. I completely agree with you that we should be looking at it in a child-centred way so that we meet the needs of each individual child. But when I was teaching, I was not an expert in meeting those needs. I needed experts. I needed people to tell me how to do that. So just to say a blanket, well, you know, the children's social care or the schools or somebody else will meet those needs. We don't need a diagnosis. Seems to me to be suggesting that there is no need for diagnosis at all. So if we don't need a diagnosis to meet need, why are we doing a diagnosis? And I think the families would absolutely not agree with you, and it is not the experience of families that having a diagnosis does not unlock. Having a diagnosis does unlock, and it unlocks for a lot of people not just services but an understanding of themselves, an understanding of where they are, their position, and so on and so forth. And for families and for the young people themselves, that is hugely important. So I think we need to be more ambitious about this and not just say 2 years. Well, OK, we'll get it down to 2 years because it was 3.5. So 2 years seems pretty good. It's not good enough. It's not good enough to meet the needs of our children and young people. Thank you.
OK, Can I take several questions, or do you want to answer one per each? What's the best way, because there are 3 of you?
I think where I think I'll pick up that the question around the rates in 2 years is the neurodiversity weights, the weights within child and adolescent mental health and adult mental health services are not 2 years. So I'll pick it up around the neurodiversity. We don't think 2 years is a good enough wait either, and I apologise if I've made you feel and presented in the way that we think 2 years is acceptable. Within the current referral rate and the current resources, we are aiming for 2 years. That is our aim, but we do not think 2 years is acceptable. And I'm sorry if I came across saying I didn't think diagnosis was needed. There are, of course, children, young people and adults where diagnosis makes a huge difference to them. Louise talked about their understanding in their place, you know, and how they make understand. And clearly we are fully aware that there are parents as well as children and adults that actually really benefit from knowing that diagnosis. What I was trying to explain, albeit clearly quite clumsily, is actually what is also important is meeting people's needs. And a diagnosis, especially with autism, is a label, and children and adults with a diagnosis of autism have very different needs from each other. And so what is important is we recognise the needs and meet them. And what we're not saying is, oh, schools or social care can just do that, but we all play our part. It may be that the child's needs, they may be sensory, in which case it's actually, for example, an occupational therapist that may be the appropriate professional that can meet the child's needs, and may be doing that either by the child seeing the occupational therapist or the child supporting the family or the schools in how to change the sensory environment for that young person. It may be that the child's needs are more around social communication, in which case it'll actually be, for example, a speech and language therapist that can work with the child, with the family, with the schools on how to support that child's development of social communication. It may be it's around social emotional well-being, and generally it may well be a combination of many factors. So it isn't just about the schools can do this or social care can do that, but it's the variety of professionals out there, and I include the third sector in that because Autism Berkshire provide a huge amount of services, a huge amount of webinars, workshops, support to the families and also the children and young people. And those are the key services about actually supporting the child and their families through their journey in life. So I apologise if I made it come across that I didn't think diagnosis is important, that for some people it is absolutely key. However, whatever the diagnosis is, whether the child ends up with a diagnosis of autism or not, together across all services, the key thing is that we can meet the child's needs before and after and during their time on the waiting list.
Okay, thank you. Looking at the time, I think if you are able to take notes, I'll call in some of the councillors here, and then you can answer the questions as they come. So I'll start with Councillor Keane, and then come to Councillor McQueen, and then come to Councillor Robinson.
Sorry, just slight technical hitch there. Thank you, Chair. So a couple of things. You mentioned about children being able to get support through Autism Berkshire pre-diagnosis. There's also an organisation called Parenting Special Children. I don't believe you mentioned that, but
no, sorry. But there is. Thank you for reminding us.
And thank you. Just in case you didn't know that. So they also provide similar sort of support pre-diagnosis. But we've talked a lot about diagnosis, but we're basing some of the support around people assuming that they may have autism and ADHD. So perhaps there are going to be support mechanisms in place, and organisations, particularly the voluntary sector, who may support them. And they could take quite a lot of time. They'll work with those organisations for quite a long time, building up very good relationships, getting a routine around it. And then what happens if they do have their assessment and they are told they don't have a diagnosis of ADHD or autism? And that does happen. It's certainly, I've come across adults who have been told that they don't have ADHD after, having support for some time. Thank you.
Did you say what happens? Organisations like Autism Berkshire will continue to support.
Sorry, could I let the other councillors ask the question so that because we're looking at the time, it will be very difficult to get through everybody, because this is a very topical issue, mental health, and we really want to hear all of the people that are asking. Thank you. I think it was Councillor McQueen and then Councillor Robinson.
Thank you, Chair. I'll be really brief, and you don't actually have to respond to this now, but I really wanted to thank you for this presentation and report. It's so useful, and I echo other councillors' views, especially around wait times. I'm just really interested in the area around the one team aims, and I know we probably haven't got time to go through this again, but I think that's a really from casework I've received and chatting to people in the community, there are people may be given a diagnosis and medication, but it seems to me that we're talking about the kind of the step down approach to care, and so working with GPs and some I've had casework where people haven't had a great relationship with the GP, and it's almost kind of they're sent home, given medication, given a diagnosis, and then kind of left to deal with it, and the family kind of struggling. So I welcome this the one team aims, and to know more about that. I know we haven't got time now, but I think that's really useful, and I'm hoping that that's going to sort of encourage that more of a relationship between the GP and access for the the patient, the member of the public to access services. So thank you.
Thank you, Councillor Robinson.
Thank you, Chair. I'd like to echo what Councillor Gavin said. And I'm looking at page 24 of the report, page 48 for us. What support is available now? There is often a misunderstanding that a diagnosis is needed to access help for autism or ADHD. My point is that surely a diagnosis is highly important, given that there are so many different levels of autism on the spectrum, and each different type of autism requires specific support. And also, isn't it true that a diagnosis leads to funding for care of autism as well? In which case, a package can be put together to assist the child. I mean, as it's been mentioned, 2 years waiting for a diagnosis of ADHD or autism is, preposterous when we're talking about a child's education and giving that child the best chance of a great future. It needs to be speeded up, and whether that involves, obviously it would involve extra funding for this, but also using third parties to, provide the diagnosis needs themselves. So that's all I have to say. Thank you.
Thank you. Anyone in your team wants to respond to this?
Kishan, I don't know if you wanted to say something quickly about one team.
Yeah, I'm happy to answer that. So that kind of experience of patients having that cliff edge, following care being received from secondary services like CMHT, and therefore from GP perspective, they're kind of getting medication only and not much follow-up. And I think that's kind of what you referred to. So the aim we have is with the ARS workers, kind of the mental health practitioners in GP surgeries, they're able to offer some follow-up. But also we have the mixed team, and then who will be able to, suppose in terms of a gradual step down approach into primary care, so making sure their needs are being met. And then the wider assets that are available in the community, where kind of Let's Connect come in. So they'll be able to find other service provisions that are out there that could support people. So you don't have essentially that cliff edge, there's nothing after secondary mental health. So that's kind of what the one team is trying to do. And we're making some headway there. It's early days. We also kind of bring in some voluntary sector partners to work alongside us to deliver some of those community navigator type functions for our clients as well. So I don't know, I hope that answers the question.
Okay, any response to the other questions that were asked by the councillors?
I think I've probably responded to them in the past in terms of, yes, we think 2 years is too long. Yes, we think that some needs can be met in terms of the child's needs, in terms of their sensory needs or their communication needs. I can only comment from the health perspective that a diagnosis doesn't open up packages of care from the health perspective. The SEND agenda, we talked about education. If we look at the SEND, it's around a child's needs rather than diagnosis. So I'm not in a position to comment on where a diagnosis opens up funding from my health perspective. We would be looking at around the children's health needs and how we can support a child in school or education based on the needs that we can provide. I've given examples: speech and language therapy, occupational therapy, our mental health services. We talked about pet care training going into the schools to support the schools to look at how they can meet a child with who is neurodiverse and how we can meet their needs.
Thank you. I just wanted also to come in because this is one of the things that I see in the community, and I've seen it having worked in the community mental health team for some time long ago. Kishna, you've talked about in the beginning about the burnout, and on one of your pages, which is page 4 and 5, there's a statement about the caseloads that are happening, but I wondered if also we could get a clarification about I know that the caseloads in mental health, when somebody has got maybe 2, it all depends on what they are. They can be so much work in 2 cases, but trying to see the rationality of the balance of the staffing that you say you have tried to fill, but they still burn out. So I wanted to find out what is actually happening and how is your staffing, because that's quite important to see the outcomes of how people are looked after in the community, especially, or also whether they're hospitalized or sectioned. And you also, Kishna, mentioned about the social network and support for people into employment. Can you expand on that? Because as councillors, we see these cases come for people local people that have got mental health who are struggling also to access employment, and getting also the social network because they get isolated when they have mental health. But how do they link into these services? It's my first time to hear about that. I don't know whether it is decentralized to the communities, which is one of the things mental health doesn't do well, to decentralize services to the communities. And also my last one is probably on the question of children with neurodiversity, special autism. The speech and therapy part of it is quite important for children, that even if they are not diagnosed or are waiting for diagnosis, and the families or parents or caregivers think, oh, my child might be autistic, we are waiting for an assessment, but there is that special needs where they are growing up as children, and the speech is quite important. The speech therapy is quite important for a young child to have that instantly without even the assessment. But sometimes the assessment is the one that is holding the services, as most of the councillors have said, to be put in place for the children to have these services. And then by the age they go to school at 4 or 5, they can't even speak in that sense, where they could have had intervention earlier in that sense. Thank you.
You want me to go first, Karen?
Yeah, if you go first, and I'll pick up the speech and language therapy.
Sure. Councillor, I think the first question was around vacancies and what that position looks like within CMHT. So we do have quite a number of care coordinator type roles vacant. We are using agency staff where we can, but again, there's a challenge around agency staff being found in our area. What we have done is we've kind of looked at skill mixing. So where we previously recruited or employed experienced staff, we're now gone to maybe newly qualified staff being brought into our teams, and so that we can then grow our own and develop that skill. We also kind of brought in some new roles like nurse consultant type roles, so that who can then facilitate that piece of work. It could bring some stability to manage burnout. But we also have a well-being team with pretty much focusing on supporting teams who are going through that difficulty. So how, managing caseloads, we've got quite a lot of complex presentations. So that's kind of what we're doing. So whilst we have the vacancies, we also want to make the place attractive to come and work. So those things hopefully will have a ripple effect, and we can get staff into those roles. I think the second question you had was around IPS, so the IPS service is designed for clients who have an SMI. So it's very much focused on patients who are receiving input from CMHTs. We have extended it to mixed services, and what the aim of that service is to help people into employment if they wish to do so. And the service also operates within our kind of early intervention psychosis service as well. And what we identify is also that there are people who are in employment, but they may be struggling because of their mental health difficulties, and that team is able to provide support. One of the challenges that those practitioners have is to find suitable employers who will be willing to employ our clients. So what they do is they also canvass local employers around opportunities that might be available, and then try to match people into those roles. So that's kind of essentially what the IPS service is. It's very much designed around the clinical team identifying clients who are able to, who are suitable for that, but also clients' wishes as well, so people, patients can self-refer. So I hope I can answer the questions that were asked.
Yeah, thank you.
Okay, I'll pick up the question about speech and language therapy, because Berkshire Healthcare, we provide speech and language therapy services for children as well. And children can be referred to speech and language therapy and often are prior to any concerns about autism. Not having a diagnosis in autism does not preclude speech and language therapy if a child has communication. If there are concerns about child's communication, then they can be referred and seen by a speech and language therapist. It's not diagnostic dependent. Does that answer your concern?
Yeah, it does, but it doesn't filter down to parents who always think that if somebody, as everybody has said, if they've got a diagnosis, they get all the services that are really helpful even in school. Thank you for the answer.
Thank you.
Yeah. Councillor Robinson, short one.
Yes, it is a short one. Obviously, in the news recently, it was mentioned that the police forces in some areas are stopping going out to mental health incidents, for want of a better description, and asking that the local health authorities actually deal with those incidents instead of using police resources. Is this something that is having effect yet within Berkshire and mental health, or is it something that you are preparing the way for the future?
Do you want me to answer that, Karen? Yeah.
Yes, please.
I think you're referring to right care, right time, right place kind of conversations that are happening within police forces across the country. We are involved in those conversations. The expectation from police colleagues is that we undertake some of those first interventions prior to engaging with police colleagues, but that's work in progress, and we've got kind of a fairly good working group looking that in detail to develop those strands of work, and that's kind of been looked at across Thames Valley.
Okay, so thank you so much, but I'll recommend as chair of S that mental health, including the one for adults and children and neurodiversity, is a very, very a topical issue, and that in a year's time, having looked at all these things that you have brought in, and because of the struggles also you are saying there are very positive and negative things there, we might probably think to recommend that in a year's time we come back to this, because children are being affected, adults are being affected, and see if these new implementations you are doing have worked out and rolled well in Berkshire. Thank you very much for your time.
Thank you for your interest.
Thank you.
Thank you.
Thank you.
Thank you.
Okay, so this one was a very interesting one, and we need it back here in a year's time probably. And I think that's very important that we keep talking about mental health. Agenda item 7, we move to Nayana George, who is presenting item 7. Thank you. Oh, she's online, yeah.
Good
Thank
evening.
you.
Thank you, Chair. Good evening, I'm Nina George. I'm the Information Rights Services Manager, the Complaints Manager for the Council in Brighter Futures. I'm going to present the annual complaints report for adult social care first, and this is for the reporting period 2022 to 2023. So the report tells us how many complaints and compliments were received in that year. And were dealt with using the Council's corporate complaints process as well as the statutory procedure for adult social care. The report summarises the type of complaints received and provides examples of where we've improved services as a result, and the learning that's been taken from the outcomes of investigations. So during this period, we received 89 statutory complaints. This was a slight decrease over the previous year when 93 was received. 10 corporate complaints were received, and this was a significant decrease, 50% compared to the previous year. One of the corporate cases progressed to a stage 2 investigation. All 10 of the corporate complaints were investigated to an outcome, and 70 were responded to in timescale, which is within 20 working days. And this was an improvement on the previous year when only 66.7% was responded to in time. 1 or 10% of the complaints, of those complaints, were upheld. 60% were not upheld, or 6 complaints. 2 had no outcomes or findings, and 1 had multiple outcomes. Now that means there would have been several strands to the complaint, so some would have been upheld and some not, some possibly partially. Of the 89 statutory complaints that were received, 88 were investigated, 1 was withdrawn by the complainant, and 70.5% of the 88 were responded to in time, and that was again a marked improvement on the previous year when only 55.8 were sent out in time. And within adult social care statutory process, that's 15 working days. 31% of those were upheld, 82.2 were partially upheld, 35.2 not upheld, and 18.3 had multiple outcomes. The remaining 4 had no outcomes or no findings. The main themes for the period across both corporate and statutory were the quality of service provided, staff conduct and communication. Everything's detailed in Appendix A for you. In terms of Ombudsman cases, 5 cases were referred to the Ombudsman, not by us but by the complainant, and 4 of them progressed to investigation and they were all upheld. 1 was not investigated after assessment by the Ombudsman, and Adult Social Care Service had no public reports in that period. They also received 42 compliments, compared to the 10 that were recorded in the previous year. So that's just a quick overview and a summary. I'm happy to take any questions.
Okay, thank you. Councillor Gittins, do you want? Okay, all right. Councillor Davis, you go. And
okay, well, that's very gracious of you. Thank you for this report. I think sometimes an increase in complaints is not a bad thing, because it can mean that you're looking for constructive criticism and ways to improve your service. But in fact, there's lots of sort of fluctuations, but good. There's lots of figures going in the right direction here. One thing you did zoom in on is the corporate complaints received, and it's quite noticeable that there's a drop of 50% in the corporate complaints. I wonder, because that is probably the biggest change in the whole report, I think. I wonder if you've got any explanation why that is. Is it really? I mean, it'd be good if it was. Is it really because we're twice as good as far as corporates experience is concerned, or is it something else that the routes for complaining were not as open or as usable or whatever? Yeah, that's my question.
Sorry. Yeah, I couldn't see any particular trends as to why. The corporate complaints are more sort of from care providers around invoices not being paid possibly. So it's not necessarily, they're not from service users. And in fact, for adult social care, that's the high numbers we had last year were quite unusual. I mean, the data for this year shows that there's significantly low numbers of corporate complaints in adult social care. And I couldn't tell you off the top of my head why that is, I'm afraid. It's not through a lack of promotion of the complaints process, because all of our service users are given information about the complaints process when at the point of assessment or entry into the system, and also our processes and our contact details are widely publicised on the website.
Okay, thank you. So it's it looks like it's a genuine improvement.
Yeah.
Well, it's to be very much welcomed. Thank you.
Okay, Councillor O'Connell, and then you come to Councillor Robinson.
Well, mine's going to be very quick, because basically the same figures had jumped out of me at me as had Councillor Davies, and you have answered that quite reassuringly. In which case, I just want to reiterate again what Councillor Davies was saying, that I think it's a really healthy reflection on an organisation to have a robust and open complaints procedure. Yeah, keep taking those complaints and keep investigating them. I think it does well for us.
Councillor Robinson.
Thank you, Chair. Again, thank you for this report and all the hard work behind it. One question I have, when I look at the complaints and compliments for the next one, for agenda item 8, there is sort of a figure there that makes sense to me, in that it tells me how many looked after children there are. When it comes to the adult social care, it doesn't explain to me how many interventions actually took place throughout the year. And it's probably hundreds, if not thousands. So that gives me a much better idea as to where we're going if we get only 89 complaints from so many cases. So it would be useful if we had that sort of data at hand, so that it can help, you know, make the impact more so for councillors reading these reports. Thank you.
Thank you. We'll include that in next year's report.
Melissa, you wanted to respond?
Thank you, Chair. I can answer that if helpful. So on average in a year, we support 1,600-ish service users and carers in the service. Clearly, though, complaints can also come from people that haven't got access to services or have been on the periphery, and we see about double that. So 3,000-ish people approach us. So hopefully that gives you a sense of the numbers.
Councillor Gittings, do you want to summarise?
Yeah, look, I'm grateful for colleagues' comments, and I think overall this is clearly a positive report because the number of complaints has gone down. But I think in a service with the complexity and breadth which Melissa Wise has just outlined, 1,600 people who are accessing the service, it would be quite plus others who are if you like, involved, having people obviously who are accessing the service as well. It will be astonishing if there were no complaints, and frankly, I wouldn't actually look upon that in a way as a good thing, because clearly organisations do make mistakes, and obviously there's some learning in the reports. But it's only really if you learn from mistakes or errors or oversights, communication, those type of things, that you could actually make improvements. So. It's a double-edged sword, this, and I would, I'd highlight obviously the compliments we've received. So if we wanted to use stats, it's a 400% increase in compliments. I mean, admittedly from a quite low base of 10, but 42. I think that shows obviously we're hopefully moving in the right direction, and long may it continue. But make no mistake, I mean, this is a very complex portfolio, and there are funding pressures, as we all know. So. I don't think we can take anything for granted in this respect, but it's good that it's highlighted in the report, and thank you for the work that you've done.
Thank you.
Thank you very much. I think also, like Councillor Gittings says, there are compliments there, but also there's also learning from the complaints that are coming out, compliments to the staff that really work very, very hard. Thank you very much.
Absolutely, thank you. I'll go on to the Brighter Futures complaints and compliments report next. So this provides an overview of their complaints and compliments, and also SAR activity, and that I should have spelled that out, that subject access requests, and this for the same period. I'll take questions later. I was going to go into a bit more detail about subject access requests, but it's fine. So during that financial year, they received 77 complaints, which is an increase of 12 against the previous year when 65 were received. And that number represents 2.7% of the cases that were referred to Brighter Futures for services in that year. Of the 77 received, 10 were resolved through alternative dispute resolution by the social care teams. So we call that informally, and we see that as being positive. So it's a quick outcome for the complainant. The remaining 67 progressed to formal investigation. One of these was subsequently withdrawn by the complainant after the case had commenced. So during that period, 14 progressed to stage 2 investigation, but some of these were from the previous year, and one progressed to stage 3. We also received a further stage 3 investigation request, although this was again a progression of a previous complaint that was at stage 2. Of the remaining complaints investigated, there were 66 which were investigated to an outcome. 28 or 42.4% was responded to in timescale. 38 were outside of the agreed timescale, and this compares to slightly higher figures in the previous year where 44% was responded to in timescale. Of the 66 investigated to outcome, 16.7% were recorded as fully upheld, 9% partially upheld, 31.8% not upheld, and 1.1% as having a no recordable outcome. The remaining 27 were complaints with multiple strands, so they had several different outcomes recorded. Top themes for Brighter Futures was around staff conduct, quality of service, and procedure, which is complaints mainly about actions or lack of action taken by the team or an individual person relating to a specific case. In terms of ombudsman cases, the ombudsman looked at 23 cases, which was 7 more than the previous year. 9 of those were investigated, 7 upheld, 2 not upheld, and 1 was issued as a public report, which was presented at this committee in October. In terms of compliments, they received 50, which were logged in 22-23. Subject access requests are requests by service users or previous service users who want access to their social care records, and the customer relations team manage that process and carry out the work the complex work involved around those cases. And we received 59 requests for records, which was 21 more than the previous year. And of those 59, the latest figures show, because this report was written in the summer, but the latest figures show as of last week that 52 have been completed, and 4 were closed as invalid requests, and there's 3 cases outstanding. So once again, I'm happy to take any complaints. Sorry, not complaints, your questions.
Oh, thank you, Nayan. Councillor Hoskins.
Thank you, Chair, and thanks for the report. I mean, I think, you know, with despite Councillor Gitting's crowing about his reduction in complaints, I think obviously the work we do to encourage complaints is really important, because we want to hear what concerns people have got. And you know, from here, I think the report's good in terms of outlining the learning and the additional report. I mean, I actually have lost track of where this. I've seen this report before, where it's come to and where it came to the October meeting or not. But the point is that it's you know, it details sort of the learning and the position, and the addendum from that's been put here is well worth reading in terms of the additional learning, and I welcome the sort of the whole team meeting to work through you know, ombudsman cases and that you know, and the learning from that. So this is all really good. I suppose one of the things we mentioned previously, which is really important and remains really important, is around the turnaround, isn't it, in terms of subject access requests, getting on top of that, and you know, I welcome the the focus and the effort put into addressing that, which is not particularly reflected in that second report, but will remain a priority, I think, to make sure we keep on top of that. Thank you.
Councillor O'Connor.
Thank you, Chair. I've just got a couple of questions. Again, you know, I always welcome a robust complaints procedure. There's a couple of things here that I'm sure are explainable, but I didn't understand when I was reading through it. So there's a couple of things I'm asking for clarification on. So you mentioned that over half, nearly 58%, were dealt with outside the agreed timescales, but there was no details about why. And the report's been excellent at saying what learning's been taken from and what actions we're taking. So I'm just wondering why so many were responded to outside of the timescales, and what we're doing to improve that and ensure that figure comes down, because that's possibly one of the few things that's sort of within our control. We've also got, oh, hang on. You state that we've started recording demographic information, which I think is a super idea to try and look for any patterns, any themes that are coming out of it. Again, what stood out to me there was that, so for councillors, that's on page 79, what jumped out at me was the not stated was the second largest group behind white British. So again, just wondering sort of why they're not stating. Is it simply that they're exercising their right not to fill in a form? You know, in which case I'm wondering, do we explain to them fully why we want this information, and that, you know, we are looking for patterns so that we can actually respond better to them as individuals and Reading as a whole. So yes, those two little details for me. Thank you.
Okay. So in terms of delays, from the data that I've got and the cases that I've looked at, the statutory process is very strict about timescales. So we record that as going over timescale, even if the delay is from the complainant. So at times we can't put the timescales on hold just to meet with the complainant. So quite often managers who are investigating the complaints are operational managers who are also dealing with protecting children, but at the same time they're trying to respond to the complaint, and a parent or carer might say they can't meet or they can't speak to them at that time. There's also been some cases where staff might be off sick, so that can cause a delay in an investigation. So it's like there's nothing specific. The staff are aware of the timescales. However, what are we doing about it? I'm going to be running a service-wide training session. I do run 3 sessions a year. However, next month we're running a complete service-wide session for all new managers and service managers, because we do have a new cohort of managers coming in to explain the process and explain the importance of responding on time. We also do reports, weekly reports to senior managers, so that they have oversight and they can assist us to chase some of those responses. So that's what we're doing at the moment in terms of that. In terms of the demographics, when we receive a complaint, my team don't actually go back and say, you know, can we have details of your ethnicity? It's recorded in the child's file and the data is taken from there. But there are, where we have tried to get demographic information, some people don't want to tell us. So there is that. I don't know what we can do to improve that, because, you know, they don't have to tell us their ethnicity.
Thank you. I just wanted to go to page 16, where you do the subject access request and on that page. Mm-hmm. Do you record any particular reasons why people are asking for access to their records? And secondly, there's somewhere where you write the lack of resources. Could you expand what it is in particular? Is it the staff, or is it because so that we might be aware as councillors here, what is it that is happening?
So a lot of people request their records. So historical records, it's purely because they've become adults and they're curious about their time in care. So they want to see what's happened, and so they request those. We also get requests from solicitors who might be involved in any sort of court processes that are happening and they want to have access to their records. We also get lots of requests, repetitive requests from our repetitive complainants. So those are the key sort of areas. In terms of why it's difficult to respond is, according to the statutory guidance, we're given 30 days. It's not 30 working days, it's 30 calendar days. And we are regulated by the Information Commissioner. In Reading, we're fortunate because we have a funded member of staff who oversees all the subject access requests. Not many local authorities have that. but we put importance to that, and we've always done that. And where we've had backlogs, we've also been supported by management to bring in temporary staff to clear those backlogs. Now, when I talk about processing those, it's not a case of a case comes in and we give them the records because we have it. Those records have to be checked and redacted for third-party information, anything that might be sensitive and might cause distress. Anything that's legally privileged is also removed. So if you imagine we're reading files that could potentially be thousands of pages, and every page has to be read and redacted before it's shared. So unless the records are a small bundle, it's very difficult for us to respond within the 30-day timescale.
Okay, thank you. The recommendations for this report is that the contents of the report be noted, that the action taken in response to learning from the complaints as described in the summary of adult social care complaints and compliments 2022 to 23 are charged at Appendix A to the report be noted. Thank you. You had
Sorry,
something,
Chair.
Naya?
Yeah, can I just add, we've recently procured some software to assist our member of staff to do those redactions much quicker than we're doing. So we're in the process of implementing the software at the moment.
Oh, thank you. That's very good. Thank you so much. Okay. Is there anything else? I think it's just a recommendation. Thank you. Thank you, everybody. Thank you, Nayan.
Thank you.
Bye. Yeah, we're going to the next one, which is agenda item number 9, which is Hilary Lotz, who is reporting on the Living Care Action Plan update, and she's in here. Yeah.
Thank you. Just to explain that in 2023, we made contact with Mark Riddell, who is a DFE advisor in regards to care leavers, purposefully wanted a review of our care leavers service. Because we want to do justice to our care leavers, but also because we were mindful of a new category within our Ofsted inspections, where care leavers were set as a separate category, where previously they were joined with children looked after. So Mark came and did exactly that, looked at our care leavers service and came up with a number of recommendations. Those recommendations transferred into an action plan and was endorsed by our corporate parenting panel in July of last year. We immediately fired away and we started with looking at our terms of reference for our corporate parenting panel, made sure that our children are standing members of that panel, and ensured that there's a good representation of attendees in order to execute our corporate parenting duties. We also looked at the current offer of council tax exemption, which was for up to age 21, and work towards that being extended to 25 years of age. Needless to say, that is included in the council's medium-term financial strategy and would follow that route. We also looked at care experience as a protective characteristic to support our care leavers in obtaining employment, but also to acknowledge the fact that having experienced care has a significant impact in their lives and should be acknowledged as such. That was then endorsed and signed off, considered at the full council in October 2023. We continue to work on our action plan. We continue to consult with our young people in making sure that we understand what their needs are and include it in the work we do. We've increased our housing offer. An additional 7 units were offered. We have also looked at apprenticeships, and 5 apprenticeship roles have been identified in different departments. We have worked on the transitioning of our care leavers to having a personal advisor, and for that to be far more streamlined. Currently at 17, at age 17 or just before, they have a personal advisor. We're working towards that being 16. Further areas that we're looking at in regards to the care leavers offer, which is published on the intranet, is the personal allowances and settling in allowances, which is according to DfE recommended rates. We are working towards a pictorial version of our care leavers offer, and that to be available by the end of April 2024. Further looking at areas like the Care Leavers Hub, and we're currently working towards a business event in 2024. Mark Riddell is going to be a speaker at that event, and he's indicated March is a month that he can do. He will also look at March, then potentially reviewing how far we've progressed with those recommendations he's made. What is next on the to-do list is getting some champions in specific areas, for instance, housing, health, mental health, education, employment and training, and we're taking that to the next corporate parenting board. Areas that has been a little bit more challenging is associated with financial pressures. It is looking at a participation apprentice or a champion, which depends on if we have the necessary funds for that, and also free prescriptions, dental and eye care, which is in the hands of our ICB colleagues, which is on hold, partly because it needs to be across the ICB Bob footprint. Yeah, so it wasn't such a quick win. I think that's how far we've got. We are passionate and dedicated to do the work and continue to work on that action plan. Thank you.
Thank you, Councillor Hoskin. You want to?
Yeah, no, thank you, Chair. I mean, I really welcome this. When we discussed sort of like a suite of proposals at the full council and then unanimously endorsed that, I think I said at the time that this will become much more real when we bring the action plan back and as to this committee. And I think it does. I think it really illustrates what we're doing. I really welcome the hard work and passion as described, because it is not an easy environment at the moment in children's services to make headway. But I think you can see here how that can be done despite the really tight financial challenges that the service is facing. And what we've got here are real concrete actions that make a difference. I mean, the bits that I really welcome, and I think I'm really excited about the prospect of expanding out the apprenticeship offer to our looked after, and it will be largely also be included obviously those care leavers, because I think one of the key areas that we really need to address is where opportunities aren't necessarily there, and Reading is such a town of opportunities, so we really need to open those up to our children. I think it's worth explaining and emphasising that this was very much the action plan and the work here very much designed and looked at with our with some of our looked after children and care leavers, because that's really important. Which makes, you know, one of the areas that's quite disappointing, because it was coming across both in conversations I've had, and I know that it's been had elsewhere, is that, like, as you might expect actually, because it affects kids and adults across the town, access to health services, dentistry and stuff like that was something that was raised, and so it'd be really fantastic to make some progress on that. And so whilst that has that's an area of particular difficulty and that's disappointing, I know that's something that we'll keep bashing away at and seeing what we can do to make progress on it. The housing offer is really important. You know, good housing options for our care leavers is so critical in terms of you know, setting up you know, a stable and you know, and a good life. So I'm really pleased to see that improved. And around the transitioning bit, I mean, it sounds quite technical, but I think that's really important. It was something that's been mentioned as well about, you know, changing that. So I think this is you know, a really good piece of work. I think the action plan, I know what's also been done, and I've seen the progress, and it has changed a lot, is in terms of putting in place the people responsible and the dates, and, you know, a lot of work around making sure that's achievable. So I think this is really good. I'm really pleased it comes here, because it's really about our collective corporate parenting responsibilities outside of the parenting panel. So I'm pleased that it comes to this wider group. And I suppose the really important thing is that, yeah, this is good, but we need to really keep on the pressure, keep the focus, and keep delivering, and deliver the action plan. And once the action plan is probably 12 months old, think about what else we can do and how we can keep on with that ambition. Thank you.
Thank you, Councillor Hoskins. Councillor King, and then Councillor Robinson.
Thank you, Chair. Thank you. I'd like to reiterate some of what Councillor Hoskins said about the work that's gone into this. It's a great report and reads very well. I'd like to just clarify the council tax. What you mentioned there about that being extended up to the age of 25. It's currently tapered off, so it's got a sliding scale. Is that still going to be the case? It will still be a sliding scale, but it's just going to take longer. Okay, and we will get more detail about how that's broken down, because it's on the document. It just stops at 21 years old, 25%. So
yeah, I can make that available. Yeah.
Councillor Robinson.
Thank you, Chair. As per Councillor Hoskins, I certainly welcome this report and praise you for all the progress you've made. Leaving care, because you get to a certain age, like leaving home when you go to university, it's a very stressful and anxiety-ridden time. So, you know, the support that we can provide as a council for these individuals, all the better. So I'm fully in favour of this. One small point, and I don't know whether I'm the only one that's got an issue with this, but on page 10 of 19, so page 104, item 4A, to develop a housing offer to care leavers aged 21 to 25 years and care leavers entering and leaving custody. It's the term custody because normally you associate that with criminal activity and going to a police station. So I just think it's the term is slightly odd for me in terms of this. I don't know why. Maybe I'm the only one that feels that way, but custody, you have a custody sergeant and what have you. I just think it's maybe not appropriate in terms of that language. But anyway, that's all I've got to say. Okay.
They're definitely in custody. Pardon?
Can one person respond if possible?
They are in custody, so it is our duty to support them. Yeah, because yeah, yeah.
Okay, Councillor O'Connell.
Thank you, and I'd like to echo what everyone said about, you know, this being a really good piece of work. I particularly want to applaud the expansion of the focus on the 18 to 25-year-olds. This document feels like, as corporate parents, Reading Borough Council is really starting to move towards replicating what you would hope a functional, loving family would be doing. You know, you would be helping each other out with your first few months' rent in a place. You would be helping them to do their first independent eye and dental appointments and things like that. The fact that we've got those extra 7 units is super. You would, as a parent, be helping your kids maybe look through the job pages, finding, you know, their first piece of employment. And so these apprenticeship roles, I think, are really, really exciting. You know, the opportunity for people to start out, even if perhaps things haven't gone great in school, maybe because of disruption and turmoil in their lives. You know, that's not it. You're not scrapped at that point. You know, there are these opportunities opening up and available. So for me, this is a really, you know, exciting piece of work we're doing. One sort of area of question around the apprenticeships, if I can sort of delve in. So I can see how once these things are in place, anyone who's in the care system now, so anyone sort of under the age of 18 now, is going to know about this offer. They're going to know through, you know, their social workers and their LACs and things like that. What do we do about those kids who are post 18 now, but under the age of 25? Kind of how do we get, because they've already come out, but this offer will still be available to them, but they might have lost their links with social workers, with the systems. I remember when I worked in Reading Borough Council run care homes, you know, at 16 they often wanted to run, you know, and never have anything to do with things again. But if they're doing that, they're going to lose all of these really, really positive things. How do we reach the 19-year-olds that are currently care leavers in Reading, the 20-year-olds, 21-year-olds?
So we are in the upper 90s in staying in contact, 90% in staying in contact with our young people. The 19 to 21-year-old group is our target group. Looking over to Brian, who works very closely with us, with the Elevate team as well. So I can give the reassurances that those PAs that's involved with those children or young people are I wanted to say like a dog with a bone, but actually really supporting, encouraging, making them aware of apprenticeships, making them aware of what the options are and preparing them for interviews. So yes, we feel reassured by that.
If someone has lost touch, because as councillors we often come into contact with, you know, a very diverse group of people. If somebody has lost contact, how could they re-engage? Do we advertise the apprenticeships on sort of like, I don't know, the council green sheets or whatever it is, you know, that they could see, or do you have to know someone to put you forward for an apprenticeship?
I don't know exactly about the advertising and where exactly it's done. I do know that we've got a duty to stay in touch. So there is all kinds of avenues that we explore in order to make contact with our young people. So I dare to say that there will be, through one or another avenue, through the service we provide, that there will be contact, and the young people are in contact with each other as well. So we sometimes work around another young person to come back in with the young person we're not in contact with. But I'll check around the advertisement of those. Yeah.
Councillor Gavin.
Thank you, Chair. Just to reiterate the appreciation of the progress made so far, obviously an extremely important area for us. I note that this action plan is for 23-24, but as you indicated, there are some actions which just not for the want of trying, but because of circumstance have not been able to be progressed, and there are some unfinished business. In fact, care leavers are unfinished business, aren't there? There will always be there will always be care leavers, and we will always need to care. So what I'm wondering is whether there is a plan to update this on an annual basis, the action plan on an annual basis, and if there is, whether we can build in that into the cycle of this committee so that we get an update on an annual basis. I mean, it could be together with the new or updated action plan. It's just that we don't want to just kind of leave it. It's great work. We've all said so, but it would be great to see you know, the progress that you continue to make. Thank you.
Thank you. I think that's a good idea, Councillor Gavin. Is there anything else? Okay. So the recommendations for this to the committee is to note the progress made on the Living Care Action Plan and current priorities, and also to come back with it to add on top in a year's time and see all these other actions that are in here, how far they've been. Thank you very much. Okay, we go to our next item, agenda item number 10, which is the Education Committee, School Admission Policy. Brian Gradley, please. Thank you.
Thank you, Chair. Good evening. So on an annual basis, the local authority, as the admission authority for community and maintained schools, has to determine school admissions arrangements for those community schools. We do this on an annual basis. To confirm what it says in the report, there are no proposed changes this year. I would draw the committee's attention to the fact that the last time we publicly consulted on school admissions arrangements was 2018-19. I believe, therefore, for next time, so in a year's time when I bring these reports back, we would have had to have completed a consultation on school admission arrangements. So this report, there are no changes. I think this is an early warning light to committee that we will look to consult on arrangements for the following academic year to this, but there are no changes in this report. I don't intend to walk through it, therefore, in terms of any particular comment, because the admissions arrangements are consistent for the 6th year.
Is there any, Councillor McQueen?
Thank you, Chair. I wasn't going to say too much, actually, just I'm sure colleagues have had the chance to read the report, and thank officers for the report, which obviously highlights you know, the proposals for the admissions arrangements. So yeah, as Brian said, I think it's all in the report. Thank you.
Any other questions on this report, or compliments or comments? No? Okay. So this report actually invites the committee to determine the admission arrangements for community primary schools rating for the school year 2020-25, 2026, the coordinated scheme for primary schools for the 2025-26 school year, a coordinated scheme for secondary school for the 2020-25 to 2026 school year. Thank you very much. And so we are moving again to Brian Gradley with the item agenda number 11, which is school transport policy. I think there are two members who are supposed to leave. Yeah.
Chair, I'd like to suggest that as we only received the papers yesterday for this, and it's a very important and complex issue, we defer this to the next meeting.
You mean
Item 11, yeah.
They were published last week.
But they were issued to follow in the original, and maybe
it was the day after.
Okay, then I misunderstood, and I think
most of us got it on email last week. if I'm correct. Can I check with the other councillors if we all got it online last week? Is that right? Unless you were missed out.
No, I can confirm that it was published, the agenda was published on time, but the reports were published the next day, so the following day, not on the day of publication, but they were published on the next day, but they were published just under a week ago.
Okay.
They were just received
Apologies.
slightly late. Brian can confirm that they were sent to me at a certain time.
Yeah, that my understanding, councillor, was that they were circulated last week. So yeah, I don't think they were published yesterday.
Anybody who had a problem receiving them? We can note this, but I'm wondering why you got them yesterday.
No, I think I must have misread the date of an email. That's all. I had time, but I felt that maybe other people might not have had time. So, but I think it's an error on my part.
Okay. Did you say you had some interest or you didn't? I can't remember, councillor.
I said I had some interest as in I work with children who use this service, but I don't think it's sufficient to refuse myself.
All right. Okay, we'll note that. If there are things that are there that you feel you wanted again to speak about them, it doesn't exclude you to come back with it as in our March meeting, because this is an ongoing thing that we'll probably be discussing as we go. Am I right, Brian? Yeah. Okay. So to you, Brian, over to you.
Thank you, Chair. And if I look slightly distracted, it's because my computer in time-honored fashion has now got 6%. So I'm going to close that discreetly. So this paper is seeking committee's approval for us to consult, and that may speak, Councillor Cresswell, to that bit about time and engagement. The proposals here are permissions to consult, not to make a decision on the proposed policy arrangements. Bless you, Councillor. The context of the home to school transport policy that is in front of you that we are proposing to consult on is that we have not consulted on transport arrangements for a couple of years. We've referenced in terms of background papers when that was last a consideration by committee, and there are some key pieces of context and information that we are seeking to consider, and we've separated. There are two papers here. I'll focus on the substantive transport policy here, but it does relate to the second agenda as well, because it's the enshrined policy documentation that is a foundation for both. The arrangements for our home to school transport policy, we are proposing to consult on the changes that we've summarised in the introduction section, which in the few percent that I've got left, I will open my computer to confirm. That is to essentially create some policy points of clarification. So we are seeking the legal team's confirmation of us using that language as opposed to policy change. And what we mean by that is that we've added language in to clarify some key points in our policy that will make conversations, hopefully with parents, clearer, more transparent around some areas of our arrangements. And if I can be giving examples in that regard, and the bullet points and recommendations 1, bullet point 1 through to 4. The current policy does not offer as a base entitlement a bus pass or a school bus with a pickup point. The proposal is to clarify in arrangements that that's our default option. And that's partly because our understanding over the last few years has been a number of parents have had an understanding that maybe a taxi, for example, might be a default option. That's a very expensive option for transport. And as we've alluded to in the paper, does not always help children on their road to independence and onto engaging as a member of the community. The sorts of exceptional circumstances that might apply has been a source again for us over the last few years of parents not being clear. So we've specified there might be medical exceptions that parents want to think about. And we are including a phrase in there to say, for example, medical needs might be something for parents to think about. We don't think that excludes other kinds of exception, but it's just to help parents understand that that's actually a legitimate thing that parents can bring forward. that we need to be clear that parents have got some liabilities and responsibilities in terms of transport for school. Our current policy is silent on the responsibilities that parents have, and therefore clarifying with parents that this is an arrangement and a contract that's a social contract as well as our legal obligations, to specify that parents do have some obligations, and if we organise transport arrangements and they are not used, that some of the costs implications of those are ones that we would seek to talk to parents about. And that finally, our current policy framework is silent on post-16 transport. It doesn't actually say what happens beyond 16. So there is an expectation, reasonably so, in a number of family homes that continued support will happen in the same way post-16, but the policy is silent. And what we've done is we've included a clearer section to be clear that we don't have a statutory responsibility regarding post-16 entitlements, but that when we are looking at those evidenced appropriate examples for individual children post-16, that there is a clear route and a transparent route for us to follow. The proposal is to delegate in the model that's set out in the paper in terms of a statutory framework. There is a requirement for a 28-day consultation, and the recommendation is for the decision on the format and process to be delegated regarding that consultation to the Executive Director of Children's Services in consultation with the 2 lead counsellors identified. And the proposal would be that the results of the consultation would then come back to ACE committee for consideration of whether a policy could then be approved. So I'll pause my introduction there for questions, Chair, in terms of the recommendations in that report. Councillor McQueen.
Okay, so we can start. Councillor McQueen, you want to summarise?
Thank you, Chair. I thank officers for the report and for the really detailed introduction there. As mentioned, this report is asking for the committee to consult on the school transport policy and to clarify the policy. Post-16 travel is currently being provided for approximately 100 young people. I think it would be a really good idea to encourage children to go to local schools and colleges, and to encourage people to use more sustainable travel, also reducing transport emissions. I think it's important to remember the consultation. Throughout the consultation, we really need to get detailed views of children and their families, which is, as Brian alluded to, it's going to be so important to get the feedback when we come back after the consultation, when the period comes to an end. If adopted, this will be, as mentioned in the report, will be needs-led and through statutory annual review for each young person, with personal plans developed for each young person, which I think again will be quite reassuring. And I feel like the proposal aims to close the loophole, and I think it's really important to evidence what each child needs. So I'm not going to go through the timings because obviously that's detailed in the report. I think it's really important to talk about the national picture. You know, in terms of, you know, councils up and down the country are, you know, facing financial difficulties, and I think it's another issue that we need to address when looking at this consultation. So I think it's important to bear that in mind. So thank you again for the report.
Thank you, Councillor McQueen. Councillor Cresswell.
Thanks. One tiny technical point to start with. The dates in item 7.7 are a day out. I think that it's the 17th today, and as the meeting is the 16th. So, but that's unimportant. We have a current policy, and this will replace the current policy. I think it could be clearer in terms of what the changes are. So I spent a number of hours yesterday reading the current policy and reading the new policy, trying to work out what the changes are, and it's not simple. And so I think if the consultation is to be effective, I think those changes should be made very clear. The current policy has responsibilities for drivers and escorts, for instance, entirely absent in the new policy. And the new policy has special considerations that will be made for children looked after, which are not in the current policy, and there may be more. So I think for an effective consultation, that should be clear. Lastly, on the subject of taxis, they're referred to in the document, referring back to our 2020 commitment to providing taxi provision for the most vulnerable. So my question is, would this new policy override that commitment, or is that presented in the sense that the most vulnerable would still be provided for? I can't quite get that from reading it.
So yeah, Councillor Cresswell, I agree, and actually you sent me a really helpful note regarding a format we can use in the consultation. So we're going to take your recommendation and suggestion, which I thank you for, because I think then we can set that out and make sure that people can really clearly see where that language changes. So I really am grateful for that steer. In terms of that fundamental last point, what we're moving towards, I think, is within the current policy, we talk about taxi provision as a potential default, which is a very expensive and not a very enabling model of transport. So again, trying to, if we are genuinely going to commit to our policies as a council around developing independence and sustainable travel options, we need to move into a much more transparent model of saying, actually, bus pass first. Is it something where we can help you access public transport? If now, when? And then if the bus pass option isn't immediately available to you, is there a way that a personal transport budget might help you get to where you need to in terms of education? And then the idea of those buses and pickup points being another option, by specifying those as the preferred option, it doesn't preclude other options that might be necessary for a child, and hence Councillor McEwen's reference is really important. That the policy is one thing, the needs of every single child who currently get transport is something else. So we have already a statutory cycle where we can review those. What we can do is we can review it in a clearer policy framework, is the proposal. I think the consultation, when it comes back, will absolutely be about trying to capture which particular changes had most interest from people, which particular changes prompt either a concern or further need of clarification, and hopefully that will come back if committee agree for us to consult to help inform the final decision.
Well, looking at it, Councillor Cresswell, you did read the paper, did you? So I also noted what she was talking about is page 170, with decision by S committee to proceed with statutory consultation today's date, which is 17 January, not 16, so that to correct this in the documents. I will head Councillor Hoskins, and then I'll come to you, Councillor.
Yeah, no, thank you, Chair. And briefly, I want to say I welcome this and support this. I think I think it's helpful, Councillor Cresswell's contribution. I think been developing this for some time. It's easy to sort of it's good to get a fresh pair of eyes on it. But I mean, the most important thing element here is what I think comes across in the difficult balance is the emphasis on a personalised approach to individual cases. And I suppose to a certain extent that does make it quite difficult, because we're not talking about a blanket approach. It makes it quite difficult to describe that in a consultation document. I think it's worth remembering that largely we're a little bit behind the curve on this. A lot of councils have done this, have moved in this direction quite a long time before, and we can learn from, one of the benefits of being behind the curve is we can learn how to implement these things in the best possible way from others have gone before. It's also, I mean, it goes against the grain when we're talking about meeting need, but we should remember the sort of the substantial predicted increasing costs of home to school transport, and I think we shouldn't ignore the fact that if we don't do something, then costs will continue to grow, and with the situation that the council's in, that's money we don't have or we take away from really essential services. So I do welcome this. It is a consultation. I think it's the right way to go. I think it's already been mentioned, the stuff around, I think it is incumbent upon us to be supporting young people to, in the same way as I try with my kids, to take on more responsibility, to become more independent, because they were, and prepare for the real world. And I think that's important as well. And there's a benefit that we shouldn't ignore. So yeah, I look forward to the consultation. I think it's a difficult and interesting subject to take through, but it's one that we ought to proceed with.
Thank you, Councillor Hoskins. Councillor Kim.
Thank you, Chair. Thank you for this this report and for your presentation on this. I'd just like to ask about the post-16 transport, 4.4 on page 169, looking at where the students are going, and there's quite a few places that are perhaps not so easy to get to on public transport, such as Bucks College. And perhaps some of the reasons that students are going that far out is because these courses are more specialist, and they themselves are probably going, I'm making an assumption here, but they are going to have a more specialist need. So again, I am making that assumption, but firstly, is it possible to get some sort of figures on how many students are going out that far? And whether it would be, I also saw a mention at 7.6 about possibly engaging Reading buses on something like that. Could we have a little bit more detail on on that, please? Thank you.
So on the point in terms of numbers of pupils and students, we made a determination in terms of this report because of the numbers that could be potentially identifiable information. So they're very, very small numbers, less than what might be identifiable. But your question absolutely is a correct one to raise, and aligns with a related report that will be with ACE committee next time. So sufficiency of local specialist education provision for children is an aligned report that you'll see on your forward plan. And the intention is that the results of this consultation being seen alongside that will enable councillors to see what the results of this consultation are, alongside the plan to ensure that as many children as possible can access a local college or a school place. A strategic position that I have and that we have as a department at the moment is it probably would be better if every single Reading child could access the education they wanted and deserved within Reading or closer to Reading. So there is a particular challenge in the post-16 landscape in the way that colleges have been funded, and we as a local authority have not got the same role there that we used to. And some colleges have a specialism here and a specialism there. Our strategic intent is actually for Reading youngsters. We should be able to provide inclusive education for all here. So that will be a very, very similarly related point, Councillor, that you will then be able to hopefully look at the consultation and the plans for more local provision in a tandem way and look at things in that way. We will look to see in the next report exactly how we're going to capture, because there's probably going to be some quite small numbers in terms of students, how we can do that in a sensitive way that isn't identifiable or breaching any confidentiality. So we will work that one through as much as we can.
Thank you. Councillor O'Connell.
Thank you very much, Chair. That last bit was really interesting about the provision in Reading, because a lot of, not a lot, as you've just pointed out, which is very interesting. I'd love to, can't wait to see the figures on it. And they are going to places like Berkshire Agricultural College because they're interested in agriculture. And the people, whoever it is who's now running Reading College, have no interest in providing a course on agriculture in the middle of an urban environment. So, that they are not going to match up. But let's get the data. Let's drill into it. As somebody who has fond memories of sitting with Councillor Edwards chairing the School Transport Appeals Panel back when it used to exist, I think clarification around this policy, oh my goodness, yes, let's empower parents. Let's give parents the information so that they can make the best possible decisions for their child. There was nothing worse than having a parent who's made a decision to go to exercise their parental rights to go to a school that's miles away from their home, then finds themselves in a financial position or a family position where they're no longer able to get their child there, and they're asking us to now pay for that decision. yeah, I mean, it was awful. Having to go through those things. So if we give them that information right at the start, then at least they're making informed decisions, and perhaps accepting some responsibility for the outcomes of those decisions. So yeah, I really, really welcome the clarification. I think we've got to consult on it. I am concerned about the reduction in post-16, but I also hear, I think actually in this chamber, we're reflecting that horribly delicate balance between finances, what we physically can do, and what we actually want to do. You know, I mean, I don't think there's anyone here who would want to be restricting any young person's access to a course they want or a school they want to attend, not one of us. But the finances aren't changing anytime soon. Well, except that it's getting progressively worse. So, you know, I recognise that, and it's painful, which is why I think we should be giving some of these decisions back to the people of Reading. You know, let them decide, you know, if you like, where their priorities are, and steer us to try and manage it as best we can. The only sort of concrete question I've got for you is, if students have started a course with transport provided, so let's say they've started a 2-year course, when this consultation goes through, we would not look at pulling the rug, please, would we?
So I can reassure Councillor that the mechanism by which any individual young person would be impacted by this change in policy would be through their annual review. So that the vast majority of the young people we're talking about in terms of eligibility for transport or have an education, health and care plan, certainly when we're talking about our students in post-16 provisions, we're talking about those unique and as you say, though, I think Councillor King mentioned levels of need and complexity. So the mechanism for how this will be reflected for individual young people will be through their annual plan process. So what they would see is hopefully that policy change would then enable conversations through that annual plan. And we have a range of statutory responsibilities to secure the provision for children under Acts of Parliament in that regard. So this paper, I think, gives you that assurance that if these policy clarifications are made for September 2024, it provides them the context within those individual plans can then be discussed, hopefully in a clearer fashion for parents and for young people.
Thank you, Brian Bradley, on this. So the recommendation is that as committee agrees to consult on school transport policy clarification, that as committee delegate the format and process of consultation to the Executive Director, Children's Services, in consultation with the lead counsellor for Children's Services and the lead counsellor for Education and Public Health. Do we agree? Yeah. All agreed. Thank you. Thank you very much. So we are moving. We'll have to ask Councillor Davis to come in now. Yeah, we're going to move to agenda item 12, which is also Brian Bradley. Okay, so we are moving to sorry,
Chair. Although that is not directly in this, I mean, I am the member governor of Maiden Early School, and I forgot to let you know about this one. Is it relevant to this? Should I leave? Although I am not directly involved in any policy in the school, but I am the member governor of Maiden Early School.
You are a governor?
Yes.
Of the school?
Maiden Early School.
It's different, isn't it? Yeah, it's different.
Okay.
Because this is Chiltern. Yeah. Okay. Yeah. 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 Okay. Okay. Yeah, you're right. Yeah. Okay. So this agenda item 12 is a proposal to change Chiltern Edge School transport arrangement. Brian Bradley, this one again.
Thank you, Chair. So there has been a long-standing historical need that hopefully is set out in the paper for the council to have been historically providing travel assistance to children attending Chiltern Edge as it was, and then it became Maiden Early Chiltern Edge when it joined the Maiden Early Trust. We have a new secondary school opening in Reading, which is an important moment for us as a town, and we'll be taking in pupils from this September 24. So this is a second and aligned consultation proposal where we're seeking approval to consult on the removal of the historical arrangements which have given free bus transport for pupils attending Maiden Early Chiltern Edge. There are three potential options that are being considered within that consultation, which would be run in the same way in terms of the statutory approach being taken, and they are set out and described in the paper about potential options. So option one to consult on would be to remove the entitlement for free school transport for all pupils attending Maiden Early Chiltern Edge, current pupils and those that may be starting in September 24, and remove that entitlement from September 24. That would be the option that would secure the largest saving as set out in this paper, but obviously would have significant impact on families and groups, and that would be a critical part of the consultation to understand impact. And this consultation, councillors, I think will have a particularly unique differential in that regards to the previous one, because these changes, if they are approved, could make a difference and impact on individual children's lives outside of an annual process. So that would be number one option. Number two option would be a phased reduction based on year groups. And that's based on the proposal that from September 24, parents may have other options to attend the new River Academy School, which will be opening in September 24, but children in other year groups won't have that option because actually River Academy, a new school, councillors may or may not be aware, doesn't usually open for years 7, 8, 9, 10, 11 all at once. A school will usually open for a couple of year groups, usually the intake year, the first year of secondary, and perhaps the A-level year. Those are usually the years that schools would open for. So the phasing consultation could say that could be the proposed change, that over a number of years, probably 3 years, phasing would occur aligned to the opening of year groups with a new secondary school. The third option could be a reduction of the eligible area that the transport is provided for. So it currently provides across a number of areas of postcodes and certain areas of North Reading. Over a period of time, that could be phased to reduce the size of the circle. Those are the three models that could be used to try and fairly and transparently look at either an immediate cessation of all entitlements from September 24 or a phased reduction in those eligibilities and entitlements based on either year groups or on geography. The real context with this paper is probably on 2 points and the rationale for this being brought forward. One, I think, as Councillor McKeown's already alluded to, the significant transport challenges we are facing means that the affordability of what is a unique arrangement that's not required under statutes, that has been custom and practice legitimately for a period, but is a rare area of discretionary spend, is difficult for us to support when we were just having that conversation about very vulnerable young people who may need expensive transport to access their education. So this is a difficult choices picture against a national picture of really challenging times on transport. And the second issue is one that as a council we're committed to looking at reducing inequality, and this is a unique arrangement. Other parents in other parts of the borough do not have the privilege of this eligibility to ensure that their child can access and transport schools. So as an equality issue, it is one that would also bear consideration, we think, in terms of the consultation. There's a lot in this, so I'll pause and not do a more substantive intro, but welcome questions on this item.
Councillor O'Connor.
Certainly support it going to consultation because of the change in circumstances with the building of the new school. However, the simple question, have we done the numbers on if, I'm sure it wouldn't happen, but if all the parents chose to, if we stopped it, option one, and all parents weren't able to fund it themselves. So have we got the capacity in that area, bearing in mind what you said about definitely year 7, possibly year 10. I think you meant GCSE rather than A level. Yeah. The other year groups, do we have actual physical capacity in the Wren? Trying to think of what else is close. I mean, High Down. Yeah. Clarification. I'm talking about the first year. If we stop it all in 1 year rather than going with the phased approach, would we have the capacity, the physical capacity to absorb those pupils into Reading schools?
So yeah, so our initial analysis says that we would be able to absorb the number of children we will need to absorb. One of the contingencies we may need to execute in that regard would be to ask Maiden Early River Academy to open to more year groups. So that would be a contingency plan that would be available to us. But we also have had representations from, for example, Gillett School, who are also asking for more pupils to be attending their school. So there's various bits of capacity that we
surely
think
we're
might be
talking
there.
about transport to Gillett's now, which
So your answer about affordability and in terms of where it's come through, our initial analysis says that there is that capacity. One of the key things, again, in terms of the responses for this consultation for you to consider in terms of overall numbers, is for this committee to see those numbers as part of the consultation. So the intent is to get the feedback from parents, see what their intended behaviours and outcomes might be, and then for councillors to see what the options would be in terms of how we would mitigate those. So our initial analysis, yes, but the initial analysis, this is why we need a consultation period to really get into this, really understand what parents think, what their behaviours would be, so we can really get, there's a level of granularity we need here, which is way beyond desktop. So hence we didn't put it in here, because I don't think it is a level of significant assurance for this committee to make the decision on. The point of the consultation is to get to that level of how does this approach ensure that children will fairly be able to access schooling, and particularly with the cost of living crisis, and particularly with the disadvantages that some of our families experience, that there's a level of mitigations for those.
Thank you very much. I'll wait for the result with the consultation.
Okay, I go to Councillor McQueen, and then Councillor Cresswell, and then Councillor Gavin.
Thank you, Chair. I was just going to sort of speak about the report, and obviously at this stage we are, as colleagues are aware, this is a consultation. I think it's, you know, I really welcome the report and the details included. I think section 3 is really useful to go through and outlining the historical reasons for the current arrangements, which are complex. And I think, as Brian highlighted, I think it's perfectly justifiable to review this. And it's very interesting to read actually about the historical reasons. That's before I was elected. We're very lucky. We should be very proud that we've got a school, River Academy, opening, which is, you know, supports ambitions of high quality school places for our children in Reading, which is something to celebrate. I also want to talk about Reading buses, and I understand that Brighter Futures for Children are engaging and having meetings already with Reading buses to talk about different options, which again is going to be, you know, useful for families, very important for families. Section 3.9 in the report highlights the impact monitoring proposals.
Excuse me, Councillor Hoskins and Councillor
highlights the impact monitoring proposals, which I hope will provide assurance to families, and especially if there's deemed to be adverse impact financially for families. So I think that should provide some reassurance. And, you know, again, as I said for the previous report, we have to look at the national picture. Transport costs, education costs, you know, councils are facing financial hardship. So I think it's an important time to have this consultation. So thank you, Brian, for your report.
Thank you. Councillor Cresswell.
Thanks, Chair. I think it's a good plan, and it will be great if more of our kids are educated in Reading. The thing that concerns me is for the phased option, the choice of 3 years rather than 5. Maiden Early Children Edge is a 5-year school. The kids joining in year 7 in September will expect to be there till year 11. And so a 5 rather than a 3-year would be more consistent with the statutory guidance of 6.5 that children should be kept at the school they're at if possible. And my worry is that with a 3-year phasing out, we'll be pushing the kids who can't afford to pay for the bus to switch between year 9 and year 10, and that's not a good time to switch school. So it's probably quite low numbers, I think, but that choice, I believe, would disadvantage the poor, hit the poor hardest, and I would prefer us to offer in consultation to get a clearer picture a 5-year ramp.
Yes.
So the format of consultation will exactly pick up that bit about the positive alternative options, and our proposals is about positive alternatives, because there's a bit with these sorts of consultations, until you've really engaged with the community, you're never completely certain. If I give an illustration of that, when we were talking to Reading Buses, the intelligence that the Reading Bus Company have given is that there are certain patterns of transport use that might mean that there could be some Reading buses put in place instead of us having to do the contracting arrangements that's in here. And that could be a very different model. So I think part of the consultation will exactly trying to be what are the positive alternatives, and the particular focus of that will be to try and make sure we are looking at what those positive arrangements are for those families who might suffer most disadvantage. So there is that bit. The statutory guidance, that the reason we put it in there is specifically for that reason, so councillors could be aware of it. It is correct that we can look at the wherever possible guidance, which says you should try and ensure children can stay for wherever possible. The financial challenges we are facing absolutely constitutes an issue which is reasonable for us to look at shorter timeframes. So that's a tested principle, but the reassurance I can give is within the consultation there is absolutely that bit about the positive alternatives, because whenever you start these things, this has been the custom and practice for a long time. There might be some really good community ideas about how we could support sustainable travel in a different way than the current quite, you know, resource intensive way of us block contracting for buses. Oh, and perhaps one other thing I haven't mentioned that I meant to, the policies that are being consulted on in terms of the wider generic policies also still include in there the exceptional circumstances and eligibility regarding families who are facing hardship and poverty. So again, that I think will be an interesting part of the cross-referencing of the two consultations to make sure we draw that out for councillors. You know, will this overall policy change provide sufficient enough of a safety net to help support decisions in terms of this proposal as well?
Thank you, Brian. Councillor Galvin.
Thank you, Chair. I'm going to pass. I think most of the points I was going to make have been made by others. This report will come back to us when we will discuss it, the substantive in detail, and I'm sure we would all like to go home, so I will pass.
Okay, last, Councillor Robinson.
No, I'm not going to be intimidated. Yeah, this agenda item certainly raised my eyebrows a bit, because obviously I live in RG4 and my children actually went to Chiltern Edge, but I was living in Sonning Common at the time, so there was a good reason. But, you know, it's a great school. I think, you know, looking at this report, one thing I didn't appreciate was item 3.8, this saying option 1, fully removing eligibility from September 2024. This would achieve a full saving of 264k. This is currently the recommended option. I would rather, if this is going for consultation, that people are not, let's say, given that this is a recommended, this is the one we least like. It should be open in terms of, you know, allowing people to make their own minds up. I also take Councillor Cresswell's point about 3 years. If we are looking at, you know, doing this on a gradual basis, great, but, you know, 3 years is too short, in my opinion, given that, you know, Chiltern Edge also offers sixth form as well. So there will be ramifications, I think, to those families that are not as well off that could afford that. The other thing as well to bear in mind is that, you know, the new school, and we certainly welcome the River Academy, is quite a distance from where we live in Emma Green. So will there be transport arrangements for them to get to the river, or will it be a walk, you know, which is a couple of miles, I think, at the best of times. So, you know, in terms of convenience, there's also that to look at as well. It'd be great if High Down had the capacity for all of our local children. That would be fantastic, but that's not the way things are, unfortunately. But that's all I wanted to say. Okay.
So thank you, Councillor. So I think that consultation model of not having a recommended or preferred option and being open, I think is a really helpful steer. So we will feed that into our arrangements, and we'll feed back in terms of SEND place planning and what we're doing as part of the school place planning as well at the next committee meeting following the consultation.
Okay, thank you. So the recommendation is that as committee agreed to consult on school transport policies changes to remove free transport entitlement to pupils attending mid and early children age school and to change current transport arrangement. That as committee delegate the format and process of consultation to the Executive Director, Children's Services in consultation with the lead counsellor for Children's Services and the lead counsellor for Education and Public Health. Do we agree? Okay, finally, thank you. Have a good evening. See you next time. Thank you, everybody online. Thank you. Good night.